Good morning, everyone, and welcome to We Care Home Care 101, my caregiver story. My name is Nancy Pierre. I am the CEO of We Care Home Care and Training Services located at 714 Broadway, Suite number 3, Paterson, New Jersey, 07514. Our phone number is 973-988-4417. Feel free to call us anytime if you have questions about initiating services or how to go about it. We're here to help you. You can visit us online at www.ouicarellc.com. On our website, you're able to actually see some of our trainings. We train our own caregivers, and they're certified through the New Jersey Board of Nursing. We are also a certified CPR training center instructor. I'm the instructor, and we're certified through the American Heart Association. So that it's important to have, I always say, at least one or two people in your home who's certified in CPR and basic life support. And that certification lasts for 2 years. And every 2 years you would then recertify, but the information is priceless. Um, and of course, we provide home care services. We Care is an agency born out of the desire to create culturally competent and quality home care services. And like someone said to me the other day, other people say that too. Um, they say it, and I'm not, speaking ill of anyone, it maybe as a selling point, but for me, it has been uh, a real life desire and a need. I think I've shared, during my last podcast episodes, I've shared about the care that I provide for my mom, present day, and how we transitioned my father, who had prostate cancer and had to transition to hospice for his final days, and how we facilitated that, and that he passed away in his own home. So home care is something that's very, very personal. I'm gonna almost say private, and I'm sharing it. I'm sharing my journey. I'm sharing my story with you here online. One of the things that I will be moving to is live discourse, where we can have question and answer sessions. I will schedule it. I will, send notifications out to our subscribers on our YouTube channel to let them know, what day and time, or, what days and time that we will be hosting these live chats. And they'll be specifically to discuss different things that that people have asked questions about. And again, when you're having a live conversation, it's kind of like whatever comes up. uh, and someone may ask a question that's been on someone else's mind, and maybe they weren't able to ask the question, maybe they weren't able to be on the live chat, but this can provide that information, resource, motivation for them to do the things that they need to do. So I just want to go back to my caregiver story. The last couple of months have been, I'm not going to say horrific, they've just been very hard. Dealing with someone who's bedbound, who was so sick, and who had to change caregivers in this, in the moment of being so ill. It's been a lot of change, because there's a lot of things that we had to restructure in order for her to improve, for her to get well. And again, I'm talking about my mom that I've been caring for, I'm going to say, for the last 3.5 years, almost 4 years now. Yeah, 4 years. Wow. And unbelievable. Yeah, it's almost 4 years. And seeing her go through this flu season that I got hit by, my daughter who's going to be 16 and got hit by, and to watch her improve, and maybe improve in I'm going to say a and still notice some changes, because she is in a phase of life um, that I won't say a constant decline. I won't use that, but there are changes when you're paying attention that you will notice over time, and where someone, and I'm just going to give an example where maybe they were able to hold a spoon up to their mouth and feed themselves more easily, and be more agile with it. And I'm just noticing even changes in her hands, because she's had arthritis for a very long time, and I'm noticing the changes there. So just talking about the different services that can help you during this time. Last week I had an appointment with an agency called Vesta Healthcare, Vesta, Vesta Healthcare. And these are resources that I want to continue to share. Like I said, this is part of my journey, but everyone's situation is not going to be the same, and not everyone's going to be dealing with someone who is bedridden and for such a long period of time, and all the things that go into preventing infection, decline, making sure proper nutrition and digestive motility, because if someone's just still and not able to ambulate, a lot of those things become an issue. And so Vesta Healthcare, they were referred, or my mother was referred to them by the insurance company as another layer of service, as another layer of care in prevention, covered under her Medicare. And so, what Vesta does is telehealth services, right? And they also provide devices in the home that can report back to their headquarters or their offices. And so, she will be getting a blood pressure cuff, what do you call this thing? A heart monitor to check her heart rate. And all of this came about, after we were able to clear her of this, terrible flu. She still wasn't feeling well. She still, was complaining about being under the weather. And I'm like, oh my God, how am I going to get her to, a better state of functioning? And I made this appointment with this company. Again, they had been calling me for like a whole month prior, but she'd been sick, so it didn't make sense to actually sit down. She wasn't going to be able to go through an hour-long initial assessment, the visit to enroll her into this program. And so, what happened? So, okay, we finally got everything together and got her a schedule for the visit. And when we sat down, they went through everything. Like, it's like she's starting a new doctor. Like she's starting, every question about, her medications. When's her last visit? What is her blood pressure normally? What's her what do you call that, her sugar, like because she's a diabetic. That's one of her diagnoses. Like what were the last labs, and who draws blood, since she's in the house all the time. So, as I think I've spoken to you guys before, AG Urgent Care, which is the company that comes in and does her quarterly well care, or prevention checkups, they also will send someone out to do lab work and to monitor. She's on medications for, actually she's not on medications for diabetes, because she's on stage 3 renal failure. So that is due to the metformin, which is a diabetic medication. I feel like I'm getting really, like, clinically with you guys, but sometimes it's that, and I happen to be a nurse, and I think sometimes while caring for your loved one, you become an allied health professional because there's so many details that you have to be knowledgeable about to keep them safe and to maintain their care. So Vesta, so timely, so apropos that my mother's been um, referred to them, and we're sitting down, we're doing this initial assessment, and lo and behold, we go through the med list. So and this is not something I do all the time. My brother picks up my mother's medications and makes sure that she knows, okay, this was refilled, that was refilled, whatever, and these are the pills, and to make sure that the aide puts those medications before her and that she takes the medications that have been prescribed. But unbeknownst to me, my mother was prescribed an additional blood pressure pill. And she's already on two that she takes twice a day, that she's been doing well with. And the practitioner added a third, and the third is a very strong medication. And of course, I'm coming to see her. I know she had been sick with the flu, but I'm trying to figure out why the symptoms of the cold and flu are leaving, but she's still very ill. I can't see any reason for it. And we're mitigating for everything. And maybe she needs a stool softener. We need to, because she was having trouble with constipation. And so again, I'm thinking of all the things that could be making her uncomfortable and how we can obtain that comfort. And she lost her appetite and she wouldn't eat. So we're going to do a lavage. We're going to get a whole, what do you call that? Enema suds bath and clean her out. So again, these are things that I do, and maybe you might not feel comfortable doing, but you may want to know about it to help your loved one who is bedbound and needs that assistance. So, I'm going through all the things that could possibly be wrong, sitting down to this appointment with Vesta. And when we get to the medication list, how is she taking this medication? My mom's been, I'm going to say, pretty well controlled with the two that she's on. She does have what is called white coat syndrome, where her blood pressure shoots up when she has to see the doctor. Well, in this case, the nurse practitioner who's coming to the home. And every time the nurse practitioner comes, her blood pressure's and through the roof. And usually, we tell the person, just wait a few minutes, take the blood pressure again, and it's back to, like, a normal range, or for her, because she has hypertension. So I guess, a few times noting this, she felt that she had to prescribe this third strong, blood pressure pill. And in doing so, created, I'm just going to say, a bad situation for my mom because she was feeling horrible. And we couldn't figure it out. But when I went through the med list, when I went through this visit with Vesta, this telehealth visit with Vesta Healthcare, we were able to identify that she was on a medication that she did not need to be on. And, am I saying to you that you need to learn about medications and go through your loved one's med list? Maybe, or maybe get someone who is knowledgeable about doing that. And this is what we call skilled nursing. And we provide this at WeCare. Skilled nursing services, where a nurse can come in and educate and go through your medication list and look for duplications. If you're being over medicated, and my mother was being over medicated, we were able to stop that medication, and I'm going to say within a couple of days, see a massive difference. She was able to eat. She regained her appetite, and even sounded herself. Like, my brother said, she sounded like she could get up and walk. I said, whoa, that's big. So skilled nursing, services aren't just, about, doing procedures, but it could be about going over your medication list, making sure there aren't any duplications, and making sure that you're safe with your medication regimen. My name is Nancy Pierre, CEO of We Care, Home Care and Training Services. We are located at 714 Broadway, Suite number 3, Paterson, New Jersey. Our phone number is 973-988-4417. Visit us online at www.ouicarellc.com. There you could find out about our services. You can inquire about our services. That message will come directly to us. You could apply for a position at We Care, and you could sign up for our various trainings. Again, Nancy Pierre, CEO of We Care. And this is Home Care 101, We Care Home Care 101, my caregiver story. Talk to you soon.